Hey everybody, I have an update vlog for you guys and I'm going to try to get this done before I fall asleep or completely space out. And I will explain what's going on with that. But I had my first appointment with the rheumatologist yesterday, so I wanted to go ahead and say how that went. People that follow my vlogs kind of know what's going on. If you don't, I'll give you a little bit of a rundown. I've been really sick since about the middle of February. I came down with a really severe case of bronchitis. At first I thought I had pneumonia, but it turned out it was just bronchitis. Just a very, very bad case of it. And it lingered and it took a while to get over. And then I finally got over it, but then I started feeling really sick really fast. And I thought I was coming down with like the mother of all flus. So I went to my primary care doctor, saw one of the physician assistants, and she said, what I'm seeing here, you don't have the flu or anything like that. She said, what I'm seeing looks like an autoimmune flare-up. She said, have you ever been tested for autoimmune disease? And I said, no, I haven't. She said, well, I want to run a very thorough panel of blood work, and I want to include a few autoimmune tests. She said, also, you're due for your physical. I want to go ahead and get that done. So she said, obviously something's wrong and we need to get as much information as we can. So I had a lot of blood work done, and I had an EKG, and I had a chest x-ray, and I had a full body physical. Well, I went back a week later to go over the results, and most of it was normal. EKG was normal, chest x-ray was normal, almost all of the blood work was normal. Things like kidney, liver, glucose, lipids, all that kind of stuff was all normal. And there were two things of concern. First of all, my thyroid level was high. Okay? One of my thyroid levels was high. Well, I have hypothyroidism, so low thyroid, but I've been being treated for it for like 20 years. So she said, you need to follow up with your endocrinologist pretty quick on this. And I had an appointment with my endocrinologist coming up within a couple weeks, so I just did that. And it turned out the last time they had adjusted my dose, I've lost weight since then. I don't need as high of a dose, so they just adjusted it back down to the next lower dose. So that's taken care of. The other thing that was abnormal, all three of the autoimmune tests that they ran came back positive, including, there was one that's called ANA, anti-nuclear something. Anyway, antibodies, I think. So the physician assistant said, based on the symptoms I was having in that blood test, she said, it looks like you have lupus. And they referred me to an endocrinologist for a official diagnosis. Well, when I went to the endocrinologist, I talked to his physician assistant about it, showed her the blood work, and she said, well, here's the thing. She said, yeah, the positive ANA points toward lupus, and it's high enough that it's definitely something going on there. And she said, your symptoms, a lot of them do point towards lupus. She said, but in order to get an official lupus diagnosis, you have to have very specific set of symptoms. And she said, I don't think you have all the symptoms. She said, I don't think you have, you're going to get an official diagnosis of lupus. And she said, but that's not abnormal. She said, you can have the positive ANA, and like, let's say 3 out of the 4 or 4 out of the 5 or however it works, you can have a lot of the lupus symptoms but not meet the official diagnostic criteria. But you're still going to get treated. They're not going to just boot you out the door. So I went to the rheumatologist, and I was a new patient, so they did a very thorough interview consultation with the nurse. She talked about my health history, lifestyle, ongoing symptoms I'm having every day that are long-term. When I have a flare-up, what happens? How do the flare-ups start? How do they play out? How do they end? And then how am I feeling here and now today? And then I saw the doctor. And the doctor went over a lot of the notes the nurse made, had me, you know, elaborate on some of the things, asked some questions to get more information about some of the things. And then she did a physical exam, which mainly consisted of pressing on pressure points on my chest and shoulders and upper back and neck, basically my upper body. And then she examined my hands really closely, the knuckles, and, you know, making fist and my range of motion and things like that. Now, I'd always thought that my knuckles were swollen and that this was abnormal, but it turns out I just have big knuckles. And for someone as bad as I am, I have surprisingly bony and veiny and tendony hands, but this is normal. And she doesn't think I have osteoarthritis because I just don't have the joint pain. The joint pain I have is when I have a flare-up, and any other joint pain is normal. Like, you know, I've been out walking around, my lower body is a little achy and creaky and sore. I use my hands a lot, my hands get a little achy, creaky, and sore. Well, I'm 46, okay? So I'm middle-aged, and I'm obese, and I've had a very, very, very active life when I was younger, so I put a lot of wear and tear on my joints when I was younger. So, you know, having aches and pains after walking around and having aches and pains after using my hands a lot is absolutely normal right now at this stage in my life. So she doesn't think that I have anything like psoriatic arthritis or rheumatoid arthritis. If I do, it's in the absolute earliest possible stage. She ordered up further lab tests. So she ordered a very detailed autoimmune panel. It's over 10 tests, I know that, and they drew 5 tubes of blood. She said, the way we're going to diagnose you is it's a process of exclusion. She said, we're going to rule out things, and then what we're left with is going to be your diagnosis. So, as of now, nothing has been ruled out. We won't start ruling out things until this detailed panel of blood work results are in 2 weeks. And I go back in 2 weeks to go over those results. She said, here's her opinion now. She said, the ongoing symptoms that I've been having long term and how I'm feeling now, yesterday and today, she said that is pointing very heavily towards fibromyalgia. She said, however, the one blood test, the positive ANA, and then some of my symptoms, especially when I have a flare-up, but some of my ongoing symptoms too, point very heavily towards lupus. Neither have been excluded, both are possibilities. I could have one, I could have other, I could have both, which is kind of scary. But I don't even know what it would mean for me if I had fibromyalgia and lupus. But she said right now, you know, she's going to treat what I presented with yesterday in the here and now, and that was fibromyalgia symptoms. She said, I'm not officially diagnosing you with fibromyalgia, but she said, would you be willing to go ahead and start a fibromyalgia treatment? And I figured, okay, what's the treatment? And she said, well, one of the things we do when we treat fibromyalgia, we prescribe a drug called Lyrica, which is used for nerve issues a lot, like neuropathy, nerve pain. When I had shingles, I took Lyrica for the nerve pain from the shingles in my arm. And she said, you know, for fibromyalgia, we just prescribe a higher dose. Or at least a higher dose than I had when I had shingles. So I decided, okay, I know I can tolerate it. The side effects are minimal. I'm loopy. It makes you sleepy, a little dizzy, a little loopy. For me, that faded pretty quick. I took it in total for close to 3 weeks when I had shingles. And, yeah, I took it for 20 days when I had shingles. And within, you know, the first 5 days, the side effects had faded to the point where they weren't bothersome at all. So we know I can tolerate the drug really well, and I've had it in the recent past, so we know I have a good history with it. I agreed to it. It's a cheap drug in the generic, and also she's my husband's doctor. He has psoriatic arthritis, and he's got a lot of problems with his hands from psoriatic arthritis causing swelling and nodules in his finger joints and knuckles. Well, a while back he had been having some tingling, like pins and needles and numbness in a couple of his fingers after he had been using his hands a lot, like working on the keyboard. And she prescribed him the Lyrica to see if it would help. Well, he couldn't tolerate it. With him, the sleepiness and the dizziness and the loopiness and everything, it didn't get better over a few days. It was actually getting worse every day he took the medication. So he had to stop taking it because he couldn't take a leave of absence from work to see if this medication would eventually, the side effects fade for his fingers tingling a little bit every once in a while. He just decided he was willing to just live with his fingers tingling because it didn't happen every day, and it didn't happen long, and it didn't, once he stopped using the keyboard, it went away after a while. So he decided, that's fine, I'm just going to stop taking the medicine, and we'll just address the finger thing if and when it becomes a worse problem. So the doctor said, you've already got a bottle of this medication. You've already bought and paid for it. He can't take it. There's no reason to waste it. She said, I'm going to write you a prescription for you for the dose we treat fibromyalgia with. And she said, that way, use up what you have. If you need to get a refill, here's your prescription. And when you come back in 2 weeks, if it turns out fibromyalgia is going to be your diagnosis, you've got a jump start on your treatment plan. If it turns out it's not, well, then we'll just discontinue the Lyrica. So as of now, that's where I'm at. Nothing has been excluded. Everything is still a possibility, autoimmune-wise. And I'm going to take the Lyrica for 2 weeks and see what happens. I feel kind of loopy. Oh. This is the first day I'm starting the full dose, and yesterday was the first day I've had it in a while. I'm going to be kind of sleepy and loopy for probably about a week, and then we'll see what happens. One of the things I'm concerned about, though, and I don't want to keep rambling too much, is if it turns out I do have lupus, one of the most common treatments for lupus is prednisone, and I can't take prednisone. And I told the doctor about that, and she said, well, we have other options. Prednisone is, commonly used, but it's not the only way to treat lupus. So I was just kind of worried that if I had lupus and, I couldn't use the most common, or one of the most common treatments, what was I going to do? But right now, the stress is knowing there's something wrong, but not knowing exactly what's wrong. And with it being an autoimmune issue, no matter what it is, it's gonna be serious. It's going to affect my life to one degree or another. And it's gonna require probably medication and some type of change and lifestyle to manage, which I'm fine with. I just want to know what I'm dealing with so that I can start researching it and I can start addressing it. So right now, all I can do is just cool my heels for 2 weeks, take the Lyrica, and see what happens. They said if I have a flare-up and it happens during office hours, come in. Just if I can get there, come in. And because they want to see what a flare is like. And probably run blood work then. So we'll just see what happens over the next 2 weeks. And I will definitely give another update when I find out more news. But as of now, I don't really know any more than I did when I went in. everything is still up in the air, so that's where it stands now. So I am gonna go lay down for a little bit. I'm about ready to pass out, so I will see you guys again soon. Bye.